Eat human.
Les humains à leur meilleur.
Shlifer মানুষ.
C'est tu apogeo.
ピーク人間
Pitówka niewiód.
All right, we're live. It's Monday night, March 16th. We have a special episode with this whole coronavirus thing going on. We're going to do no intro, just go straight into it. Really quick, I'll tell you about Nose to Tail. We're completely sold out. Everyone's kind of freaking out. And a lot of grocery stores are sold out of meat. And I guess people are trying to order online. We're going to restock on Friday. So check back on Friday and we can ship you some of that grass-fed meat. Otherwise, just, support the show. Share with a friend, family, and that's about it. So today we have Dr. Katelyn Kalstein. She's a naturopathic doctor. She's joined Evolve Healthcare with Dr. Gary Shlifer, who has been on the podcast a couple months ago. And we're going to be talking about all things coronavirus, updating everyone. And Gary and Dr. Katelyn here are on the front lines of this, seeing patients, and let's just jump into it. So say hi, Dr. Katelyn. Hello.
Hi. Thanks for having me. Happy to be here.
All right. And then Dr. Gary.
Hey there, everybody in Brian's world. Excited to be back, and I'm excited to share what we have learned so far.
All right. Yeah. Start at the top. Tell us what's going on. You've been heavily researching all this and staying on top of it and kind of know a lot about it. And I want to hear it from a doctor.
Yeah. So guys, just so you know, I'm an internal medicine specialist. I've spent my career in the hospital taking care of sick people. I now spend my career in my clinic in Woodland Hills, California, taking care of people and preventing disease. Because of that, I have a pretty unique perspective here to share with everyone. And what I will do is we'll kind of say the facts that we know, where we're at with everything, and then kind of talk about some of the new research that's coming out. It's really interesting from a research perspective in that a lot of what we know is brand new and the papers are coming out in real time and we're all learning in real time. I follow a bunch of really brilliant people who have some amazing resources and I've been learning from them. Dr. Peter Attia, I'm sure a lot of your listeners are familiar with him. He has been kind of really educational and his media platforms have been really helping everyone learn what's going on. But I've also been kind of learning on my own, reading all the papers and want to kind of share with everyone what we've learned. So let's start with some basic facts, right? So what are we dealing with? We are dealing with a novel coronavirus, a virus. For those of you that don't know, it's sort of like a living organism, except it's not. It actually acts as a parasite. In this case, the coronavirus is an RNA-based virus. So what it does is it attacks our cells. It takes over our cellular machinery and starts replicating itself. That's the mechanism on a very simplistic level of how it makes us sick and how it infects us, not dissimilar to to the flu virus or to the common cold virus. What's different, what we're dealing with here is something that no one's immune system has ever seen before. This is one of the biggest, kind of scariest components of this whole thing. This is, as we've called it, a novel coronavirus. What you should all know is that this isn't the first coronavirus. We've had others. SARS comes to mind, MERS comes to mind. And these were other viruses that were actually more deadly, but less contagious. And what we're dealing with now is something we've never seen before. And that's why, you're seeing all this response that no one's ever seen before. And I think, myself, like most of my colleagues and most of the general public, we're learning in real time. So there's a couple kind of issues that we need to all understand, and some of you have heard this already, but basically this virus is extremely contagious. There's something that we talk about called the R naught. R naught is the sort of communicability or the contagiousness of this virus. And what we think right now is that R naught value is somewhere between 2 and 4, which means that for every person that gets this infection, 2 to 4 more people from that person will get infected. This may not sound like a very hard number, but it is horrifying to say the least. And that's not to alarm all of you, but just to be real and understand why we're taking such extreme precautions, why this social distancing thing has become so important. You guys have probably heard this idea of flattening the curve. And this is speaking directly to this idea of R naught being high, in that the rates of new infections on a day in, day out basis are dramatically rising. And our job right now, we're not going to contain this thing. It's to try to flatten the curve, try to decrease the rate of new infections. And that's the best we can hope for at this point. We could talk about some treatment options later. We'll talk about mechanisms that this virus is hurting us and causing disease. But right now, those are the facts, guys. Like, we know that it's contagious. Oh, we also know that the death rate, which has been reported all over the place, is somewhere between 1% and 3%. It could be lower than that. The problem with the death rate specifically is that we do not know how many people actually have the infection. We do not have enough testing out there. The testing that's coming is coming slowly. And the reality is probably this virus is everywhere. It's in our communities. And, we may never really know the extent of this spread. So, we'll be watching it closely. And we'll see. I think one of the things I really want to focus on in this podcast is what all of us can do to protect ourselves, and also what we should have been doing all along if we haven't. But what we're going to do now after such a scary event is really focus on taking care of our immune systems. And, that's something I really want to kind of dive into. Brian and I started this SAPIEN project, and the Peak Human project really focused on nutrition, with nutrition being sort of the anchor point of your health and thus your immune system's health. But really, this is going to turn out to be a disease related to lifestyle. People are not healthy in this country and around the world. People are not taking care of themselves, and these infections have become more and more prevalent as our population swells. And I know that, all three of us here on this podcast are highly motivated to educate people on how to be healthier. And people that are healthier are doing better. What we also know is that this is disproportionately affecting elderly. This is affecting people with metabolic disease, type 2 diabetes, even type 1 diabetes has been correlated, hypertension, which is an interesting one, which we can talk about, but also smokers. So, we all know that smoking is bad, but in this case, especially with this virus, we know it's very, very bad. It really puts you in risk and in danger of getting sick. So that's really where I want us to kind of focus, is our lifestyle. What can we do to improve our lifestyle?
Absolutely. Maybe we can start with Dr. Katelyn and talk about some of these high level things. And we were just chatting before about health starts years ago, months ago, not just, yes, we can do some things now, but really living a healthy lifestyle is something you should start way before you get sick. So what can people do?
Absolutely. And what we're seeing, with this virus is it doesn't spare the young and healthy, not always. And so actually the first patient in Washington State was 35 years old. I know that there have been some reports in Los Angeles of, friends of friends, people who are needing to go into the ER who are healthy, late 40s. So we don't need to assume that just because we're healthy, and I know a lot of people are hearing this, if you're following social media or following the media at all, that even if you're young and healthy, that doesn't mean that you're immune necessarily. And it certainly doesn't mean that you can't be a vector of spread. So I think first and foremost, we need to practice mindfulness and compassion for others. That, we walk around and we don't wear our conditions on our sleeves. So you don't know, if the bank teller that you're going to see has an underlying autoimmune condition. You don't know people walking around what their health status is. And so we need to just take a cautionary approach and social distance. As someone who really specializes or is concerned about mental health, I'm concerned about social distancing for that reason. And a colleague of mine recently talked about, well, maybe we don't have to socially distance, maybe we can physically distance, and start talking about it in terms of physical distance, but still, be engaged with your loved ones and with your friends on social media, FaceTime people, get on Zoom and have dinners, whatever it is. Try to continue your life as much as you can. I know a lot of my patients with depression and anxiety, this is going to be a problem for them. It's going to be challenging. And so we need to consider how we manage our stress first. So to get back to answer your question, I think a lot of people right now are asking me and they're looking for advice on supplements or herbs or things that they can do. And I just want to put a plug for how important the foundations of health are. So of course, diet being one of them, but also stress management. So it is very difficult right now with all of the input coming in from the media to manage your stress. So I would encourage people, if you notice that you are holding your breath, if you notice that your heart is racing, if you notice that you're getting worked up, turn the TV off, go sit quietly, have some tea, because that cortisol raising every time you get anxious or stressed, your cortisol goes up and that actually decreases your immunity. There's a very clear correlation between high cortisol and low immune function. So the first thing you can do is manage your stress. The other foundations of health are sleep, of course. This is a great time for people to be catching up on their sleep and hydrating. Now, those are kind of basic everyday things that honestly we should be doing all the time anyway. In addition to that, there are some nutraceuticals, some vitamins, some herbs that could help. I want to say before I go into those that you should always consult your doctor before doing anything. So people tend to think that natural supplements and herbs are totally safe and there's no consequences to taking them, and that's not true. Actually, probably the most common, like St. John's wort, it interacts with several different types of drugs because of how it's processed in the liver. And this is why we go to school. So I went to 4-year medical school because you have to learn all of these things, the safety and efficacy of all of these herbs and vitamins. So don't just go popping whatever your health coach online said. I think it's wise first to check in with your doctor. I'm going to pause there and see if you guys have anything to add before I go into specifics.
I want to add for sure. You talked about kind of the pillars of health, how to keep yourself healthy and what to do. You talked about stress management, sleep, eating right. What we shouldn't be doing is panicking and freaking out, hoarding things and being mean to each other and aggressive because of anxiety. I think that a lot of what I saw today in clinic were people, frankly, afraid of other people. They're afraid of how people are going to respond. They're afraid of how people are already responding, and they're afraid of what the government's going to do because we are just in such a uncharted territory. And what I would want to remind everyone, and sort of what I believe, is I believe in people. I believe in the power of love and the power of connection, and sort of speaking to your emphasis on connecting with others, even during this time of social distancing. We are lucky. We live in a time where we have such great communication devices and so much ability to stay connected without physically being in front of each other, just like we're able to make this podcast today. And I think that people should really think about that and really appreciate that and appreciate their neighbors and appreciate their family members and really lean into that. And I really hope that as we come out of this, people will be reminded of those things, be reminded of the messages you're leaving, that, hey, we're all in this together. This isn't about America versus some other country. This is about humans connecting with each other and battling a war that on a microscopic level, something that, 100 years ago destroyed millions and millions of lives. I'm speaking to like the Spanish flu, when we didn't have the understanding about bacteria and viruses and epidemiology, and just we're so empowered right now. And I just want people to lean in on that instead of hoarding toilet paper, right? Like, I think everyone hears that and everyone's seeing that. And I think it's really a symptom of what's been wrong with our country and really the world, is where we've sort of forgot what we're doing all this for. And I think such a dramatic sort of situation is going to hopefully, and I believe it will, remind everyone why we're on this planet. And it's not to hoard toilet paper. It's to connect with each other. It's to be with your family. It's to be with your friends. It's to go and see your doctor or your I was even thinking like hairstyle. You want to go and get a nice haircut. Like, we're not going to be able to do some of this stuff. We're going to see a lot of our freedoms and things that we take for granted taken away. And it won't be forever. So this is a time for everyone to buckle down and appreciate what they have, what we've been having, and what we will have, and really lean into these recommendations that we're sharing with you, these lifestyle changes, and use this as a springboard to be healthier, to be happier, to be more prepared the next time this happens, because it's going to happen again.
Yeah. And we're playing the long game here. So what I think we've had this rush of panic in the last week, in every day right now feels so long for everyone. I don't know if you guys feel that, but every day it feels like there's so much more information coming out. And I think we're actually starting to settle. Like, okay, we kind of know what's coming. Like, we need to prepare ourselves for the long game. And this is the marathon. It's not the sprint anymore. We thought it was a sprint for the first, and the thing is, we've been watching this for months, or certain physicians have. Other people weren't paying so much attention, but this is a long game. And, we're projected in 18 months that at least half the population will have coronavirus or be exposed to it by then. So we have to prepare ourselves. Like, you cannot burn the way that you've been burning through your anxiety and your stress. You can't burn like that for the next 3 months or the next 6 months. So start now by implementing these things.
Huge point.
I love that. Yeah, this is a time, it's kind of like the 9/11. People are making these comparisons where cities come together and people share and, love and share in each other's burdens. And I think this is such a good message out there. It's why I wanted to have you two specifically on, because you're so mindful about this kind of thing and go beyond normal doctors and, just mechanical recommendations, and that it's all about the person's mind and spirit and psyche and love. And so what other specific things can they do?
Yeah. So, I'm going to keep coming back to this. I am getting into your question, but I have to, as an integrative doctor I get people come to me who are really invested in their health in general. Either people who are really engaged and want to be proactive, or people who have been to every doctor under the sun and can't find any answers for what they're feeling. So those are my two kind of types of patients. I will say that the first type that are engaged and proactive, amazing, but that is a really fine line between being proactive and engaged and being obsessive. And the obsession about one's health will lead to more health problems. I try to tell my patients, it is way worse for you to obsess about how bad gluten is for you than to just eat a freaking donut, because the level of stress that is involved and anxiety about their health. So again, the first thing is do your best to remain calm. Okay. I'm going to tell you guys what I put my parents on, because I think that's where I would go. And these are, in general, very safe vitamins and herbs. So the very first thing is vitamin D. And part of the reason why vitamin D is because I'm telling you guys, 70% of people that I test are low, and frankly low, under 30. So most people are low in vitamin D. It won't hurt to take them. I have my mom on 10,000 IUs a day. I'm not at all concerned about that level of supplementation.
If I may add, I also use that form of supplementation for a majority of my patients. Over the last year, I've gone to readily testing vitamin D almost essentially with every set of blood work. And I would say the average vitamin D level I see, and this is just observational, but we can look at my data, less than 25, 22. It's shocking. It's shockingly low. And I can't tell everyone how powerful it's been to supplement people and see their moods change, their lives change. And here we are seeing something that's less obvious, their immune systems affect. So I'm hoping my patients will be doing better because of that practice. But certainly if you haven't been supplementing vitamin D, it's the time to start now.
I want to make sure we tell people to get on the sun if they can and get the natural vitamin D. And we would do a whole podcast with another Dr. Joel Gould about this. Yeah. But and also I wanted to add in, I just spent some time with Ivor Cummins this weekend. Many people listening should be aware of him. He did an amazing presentation called D is for Debacle. Amazing presentation on YouTube. It's an hour and 40 minutes on vitamin D, how important it is to your immune system and health. There's so much there. It seems sometimes people poo-poo on these vitamins and stuff like that. because they don't understand how important, especially vitamin D is. And it's not just some, I don't know, I don't want to make.
There's probably more science on vitamin D
Yeah.
than any other, I mean, maybe pharmaceutical. The plethora of data, there's no shortage.
overwhelming.
And everything that I'm saying has evidence backing it. So this isn't my observation. This isn't something as we call woo-woo. These are evidence-based recommendations. The thing about vitamin D right now is we are still in winter, and well, we're going into spring, but a lot of even in LA right now, there hasn't been sun for the past 3 days. So, and even I see patients that are out in the sun often and they're not converting, and that's something some other expert can talk about. But so vitamin D. So what happens when our immune cells activate, when it sees a bacteria, a pathogen, a virus, it actually upregulates its receptors for vitamin D. So your immune cells need vitamin D to function. So it puts more surface area for the vitamin D to dock. And vitamin D is actually not a vitamin. It's a misnomer. It's a hormone. So it goes in and actually binds in the nucleus of the cell. That's how important it is. So we should really be talking about vitamin D as a hormone, not a vitamin.
And it has so many effects, everyone. Like we're gonna dive in future podcasts. We are gonna dive deep into this, but to suffice to say, this is one of the biggest contributors to people's overall poor health in general. And I think we'll see that those with profound vitamin D deficiencies will be extremely susceptible to this virus, like they are to most viruses.
Yeah, so I think we got that point across. Vitamin D is the first thing I would do. The second is probably vitamin C. So we all know how important vitamin C is. It's been studied it reduces the intensity and duration of the common cold. They are now using in Wuhan, there is a scientist there's a clinical trial using IV vitamin C specifically for coronavirus. So it's an open clinical trial. We don't have the results yet, but he is using 10 grams intravenously for patients with symptoms. And so we will be up on top of that data as soon as it comes out. Vitamin C is very safe to take. The worst that's going to happen if you take too much is you're going to have loose stools. So taking up to even 5,000 milligrams, which is a pretty high dose for most people per day, but you do it to bowel tolerance. That's kind of how we talk about it. 1, 2,000, 3,000 up to bowel tolerance. After vitamin C, I would recommend vitamin A as well for the immune system. Zinc is incredibly important. Dr. Gary, weren't you saying they're thinking about using zinc in hospitals? They're nebulizing it. I heard something in the clinic today.
Well, what I was just suggesting is that zinc is another one of these supplements that are sort of thought of in the Western world as woo. What were we saying? Woo woo. Woo woo. But we know that it helps support the immune system and treat these viral infections. And I was actually speaking with a resident physician who was visiting with me and was actually on rotation learning from me today when his program director called him and pulled him from rotation as the hospital went into red alert shutdown mode and sent all the residents home. And we were just talking about similarly with what we're talking about now, what we would do for our high risk patients. And something that I thought was woo woo when I was going through my training is proving to be effective and significant in the treatment of this stuff. So, and just another reason why we're out here talking about this stuff and sharing, because right now we don't have a treatment. There is no treatment for this infection. And I think the what we're talking about with supplementation and lifestyle is the best we have.
Yeah, we do all we can when we don't have treatment, for sure.
All the supplementation is great. And I think people know, because I talk about a lot of just getting stuff from Whole Foods, and especially people in this community who are, eating nose to tail, you can get really bioavailable forms of all these things we're talking about in the nose to tail foods, and the liver and the kidney, and, eating the oysters and the sardines and all the bits and pieces. So just you just do both.
Yeah. So vitamin A, cod liver oil, and liver is the best source of vitamin A. Of course, there is concern about vitamin A toxicity. I'm sure you guys are familiar with a case report of someone who ate an entire liver from an animal. I believe it may have been a bear. Yeah. And he passed away from vitamin A toxicity. So
that's a lot of liver.
It's a lot of liver to eat. The likelihood of that is very low. So cod liver oil, liver, zinc is in red meat and animal products as well. So yes, absolutely. And zinc, you actually need hydrochloric acid to break down. So some people even eating these foods and eating really good diets, if you don't have enough stomach acid because you're taking a proton pump inhibitor because you have heartburn, you have to consider all these things. So it is good to check in with your doctor as well.
And I'm a big believer in IV vitamin C. I've adopted it sort of from the naturopathic world, the IV therapy world. And I could only speak, what I see in my clinic and people, generally healthy people that are feeling under the weather, starting to kind of battle something like this, really respond powerfully to IV vitamin C infusions. I'm really excited to see what that data will show specifically with COVID-19.
Mm-hmm.
So let's review. We talked about zinc. We talked about vitamin A, vitamin C, vitamin D. What else would you think would be like the most essential supplement for an at-risk patient? Let's also, by the way, I don't think we described what are those patients at risk. Those are the patients that are smokers, chronic medical disease like diabetes, lung disease, and those greater than 70 years old. Presumably because a lot of them have what we're talking about, these conditions. Hypertension should also be really considered here.
Right. Yeah, so I just want to say a word about sambucus, which is an herb commonly known as elderberry. It has been flying off the shelves. It is out in all of my online dispensaries, so I know people are literally eating it up. And that specific herb has been shown to reduce the duration and intensity of influenza, so the flu. We really don't know if it has the same effect against coronavirus. There is some theoretical debate on whether or not it can actually contribute to cytokine storm, which maybe Dr. Gary can talk about. I would use caution with elderberry. My suggestion would be to take it to boost your immune system. But if you start feeling sick, so the common symptoms of coronavirus are fever, fatigue, and cough. Those are the three most common. If you start to notice you're developing a fever and you have a cough, that would actually be the time to stop the elderberry. And I know that sounds counterintuitive, but that's the best, based on the data, that's the best advice that I can give right now. And the same is true for astragalus, which is also, the Chinese use astragalus a lot to boost the immune system. And it can do that. And it's something that you could take kind of on a daily basis to boost your immune system. And if you get sick, you should discontinue it.
Yeah, and what Dr. Katelyn's getting at is that the immune system is a complicated thing. And while it works to protect us from infections, and boosting your immune system is, obviously very important, a lot of what we see with viruses is that they cause an overwhelming immune response. And when you have this overwhelming immune response, your body actually dysregulates and it becomes sick. One of the main things that we're seeing with the COVID-19 virus are folks having respiratory failure and going into something we called ARDS, which is an acute respiratory distress syndrome, thought to be triggered by this cytokine storm. The storm overwhelms your body with immune cells and an immune response, and as a result, your lungs stop working, your kidneys can stop working, and this is thought one of the potential mechanisms how this virus is making us sick. Let me tell you guys a little bit more, unless you had anything else, Katelyn, as far as some of these herbs that can be helpful.
As far as herbs, I think those are the top two that I would recommend. They have the most evidence behind them and are easily accessible. I just want to also mention exercise as being, There's a lot of data that actually heavy lifting. So if walking is all you can do, please continue to walk. Please continue to do your normal exercise routine. There is absolutely nothing to be concerned about, continuing to exercise. But there is evidence that shows that, heavier workouts like lifting weights, getting out of breath, high intensity stuff is good for your immune system. So don't be afraid to do that as well.
I love it.
So really what you're saying, Dr. Kalstein, is if you live a SAPIEN lifestyle, you're going to be pretty well prepared to take on this virus.
You're probably ahead of the curve.
So eat real food, eat SAPIEN foods, get out in the sun. If you can't get out in the sun because it's wintertime, take some vitamin D. It's very, very important. Do something for your stress management. Pick up meditation if you haven't started. Continue to play with your dogs. Enjoy your families. Lean in on your relationships. take some good supplements to support yourself.
That's it.
And sleep. No, and sleep. You gotta sleep. So that's basically the 5 pillars of health that we talk about when we're talking about SAPIEN diet and lifestyle. Let me get into though. So we talked a little about this cytokine storm that can really cause a lot of damage. But let me talk a little bit more about what we think, how this virus is working. A lot of this data is really early. A lot of it's coming out of other countries like China that have way ahead of us on it. So I'll just share what I know, and in future episodes, we'll extrapolate on this, and I'll keep updating everyone. What we do know is that this virus is attacking us through the lung and probably the intestine as well. But we know that it's attacking what's called the type 2 pneumocyte. It's one of a number of cells in your lungs that's very important for your lung function, and it actually makes a chemical called surfactant. Surfactant is important in creating kind of the hydrostatic forces that allow your lung to expand and work properly. This virus is attacking the ACE2 receptor. It's a receptor that lives on this type 2 pneumocyte. And this is what we're learning as potential treatments and potential risk factors, right? So people that have an upregulated ACE2 receptor are potentially more susceptible to this infection. Older people, smokers, this explains the correlation with smoking, at least partially. So this explains, to me at least, one of the mechanisms by which smokers are really susceptible to this infection, and people with lung disease, those whatever cells that remain with these people are very, very necessary to maintain their lung function. Also, we believe that folks with the upregulation of the ACE2 receptor, basically they have more receptors for this virus to sort of latch on and infect them. So one of the most common medications we use in blood pressure management is called an ACE inhibitor. And it actually works by binding or affecting these cells in the lung. And what we don't know is what we do know. Let me start with, we know that people with high blood pressure are much more susceptible to the infection. What we don't know is specifically why. Now, this could be related to just having high blood pressure and potentially an upregulation of these receptors. But it could also be related to taking medications like ACE inhibitors and how they affect the receptors and how they interact with the virus. What's really challenging right now for clinicians like myself, like Dr. Kalstein, is what do we do with folks who have high blood pressure that are on ACE inhibitors or ARBs? One of my worries is that if we don't know enough and we stop these medications, what happens if the response is even further upregulation of the receptors? Or what if these receptors become even more sensitized and these patients become even more sensitive to the virus? So we definitely don't have enough data to make a strong recommendation. So if you're out there listening and you have high blood pressure and you're on these medications right now, I don't really know what to tell you. I would not change treatment. I would talk to your doctor about this. If your doctor's not aware, they can do research like myself and learn about it. And hopefully we will have an answer in the near future. What I can also say is that NSAIDs, so things like ibuprofen, commonly known as Motrin, naproxen, these are medicines also that affect the ACE2 receptor. And after kind of talking about it with my colleagues, and doing research, I think right now, if we can avoid using NSAIDs, I think that would be the right step. NSAIDs, unlike the blood pressure medications, aren't generally an unnecessary medication. They can help with pain, they can help with inflammation. But right now, if we can avoid using those medications until we know more, I think that's definitely the right course of action. So that's what we know about at least how it affects the lung, how it attacks our body through this ACE2 receptor, how it destroys these type 2 pneumocytes that then causes your lungs to break down. You cannot absorb oxygen through your lungs and people go into respiratory failure. This is what we're seeing in emergency rooms across the country right now. This is also what's making us very alarmed about what happens in the future. We only have so many ventilators. And if you've been following the news, this ventilator issue is probably going to be the thing that really starts causing a ruckus in the healthcare system. And this is why. Once we run out of ventilators, doctors are going to have to make a very difficult decision. Who gets the vent? If you have 10 sick patients in your emergency room and only 5 vents left in your ICU, what do we do? I was online kind of exploring this option, and I found a nurse who actually set up a ventilator to be shared by 2 or 3 patients. It's a crazy contraption that she figured out. And I suppose in a worst case scenario, this is an option, but then these patients are going to be sharing microbes and the risk for other infections becomes dramatic. So I think in the next weeks to months, we're going to have to deal with this issue in America. I know a lot of our colleagues in Italy and around the world are already dealing with this problem. And I think that that's something that's going to be a huge challenge for everyone, not just physicians, but patients alike, to try to grapple with, like, who are we going to be able to save? I know that's really heavy. Do you guys have any thoughts on that? I don't know, Katelyn.
Well, I know that's what I read an article from a physician in Italy, and it is heartbreaking to, hopefully we won't get there. But you bring up, a good point, which is I'm getting a lot of questions of who should go to the doctor. And this might be some valuable information for the listeners here. Should I go to the doctor or not? What Dr. Gary is talking about with the lungs, the reason why people have a severe expression of this illness is they get to a point where they get dyspnea or they have low oxygen, they get short of breath. If that's you, if you have a fever and maybe you've had a fever for a couple of days and you have a cough and it's getting worse and then you're becoming short of breath, that's at the point that I would advise calling your doctor. Gary, would you add anything to that? Or would you agree with that?
Yeah, I think that a lot of doctors too are making themselves available for like telemedicine visits. I think just getting on the horn with your doctor, if you have that access, is important. But certainly, something else is if you're not a high risk patient and you do become sick and you have some symptoms, but you're not in dyspnea, you're not having respiratory issues, you're not really having trouble breathing, stay home and self-quarantine yourself. Believe in your immune system, because, the main point about this whole ventilator discussion is the healthcare system can only do so much. There's only so many doctors. There's only so many clinics. There's only so many hospitals. There's only so many vents. There's only so many emergency rooms. And everyone needs to think about each other and not just themselves. So be thoughtful. If you're really sick and you're starting to have difficulties breathing, go to the emergency room. That's the time to get evaluated when you're having those respiratory issues. Or if you become ill and you're one of these high-risk patients. If you're not sure what to do, reach out to your doctor. Call them. You don't have to come to the office. Physicians are aware of what's going on, and everyone's going to be working at their hardest to give you answers and give you direction.
I love it.
Yeah, and on that note, just one last thing here, Brian. What Gary said about trusting your body and your immune system, we're strong. Our immune system is very strong. It sees microbes every day, day in and day out. And we somehow survive. We have survived with microbes since the beginning of time. So trust in your body. The other thing about NSAIDs from a naturopathic perspective is we actually don't want to suppress this fever. The fever is your body's way of killing the pathogen. So, having that mindset, bringing the mindset piece back, when you get a fever, remind yourself, this is my body working for me. This isn't something that I need to stop or suppress. This is actually a good thing. Now we'll monitor it and we make sure that it doesn't go too high, but go in with that mindset of, okay, this is my body working on my behalf.
I'm so glad you brought that up, because that's a great point to make in general, right? So many people just, if anything goes wrong, they're like, I need some medication for it, but your body is working for itself.
And cough suppressants. So I would I don't know how I would recommend against cough suppressants. If you're getting a cough, that again is your lungs' way, your body's way of expelling the pathogen. So all of these things that we call symptoms are actually signs that your immune system is working and it's doing its job. So we know it's uncomfortable. I know it doesn't feel good and it can be painful, but we want to do our best to help facilitate our immune system to do what it's supposed to do.
Absolutely. I practice the same way. I do, one caveat is I will provide a strong cough suppressant to help people if they really can't sleep. Sometimes, a little bit of cough suppression right before bed, they can
at
fall
night.
asleep and at night and do better. But certainly not during the day. You want to cough it out. You want to breathe it out. You want to look, your body's in a battle with this virus and you've got to support its battle, not suppress the battle and let the virus take over. So I think that's a huge, important point. I want to talk about one other mechanism of action that this virus could be using to hurt us. And as we learn more, it's just going to prove how frankly how interesting and powerful this virus is. So we just described a mechanism by which it will attack you through your lungs, destroy your lung cells, and impede your body's ability to absorb oxygen into your body. Well, a second mechanism of action is that it actually keeps your body's red blood cells from being able to hold on to oxygen at the heme site. So within your red blood cells, you have a molecule called heme, which works with iron together to then carry oxygen throughout your body. And new research, and this is coming out of China, that there's specific genotypes of this virus that are sort of inhibiting this bonding of the oxygen to the heme group. And this is another mechanism by which people are dying in emergency rooms and at home and in intensive care units by an inability of the red blood cells to get the oxygen to tissues. One of the reasons that's important is doctors in China have also started using hydroxychloroquine and other agents against malaria because they work through this mechanism. I'm going to find out a lot more about this as the information comes in, but I think that this sort of two-pronged approach is why this virus is turning out to be so deadly. And because it's sort of attacking people that are not healthy, and we have so many unhealthy people, we've sort of set up a perfect environment for this virus to thrive. It's got a whole lot of hosts that are susceptible, and it's attacking us in ways that's extremely deadly. And right now, we're trying out, a lot of different treatments, including these anti-malaria drugs, including antiviral drugs, including things like vitamin C, things like vitamin D, and other natural supplements and herbs and everything, because we don't know how to get a handle on this. But what I'll tell you is that the medical community, the scientific community is working super hard. There's no need to panic again. Reach out to people that you trust, listen to us, listen to our colleagues, and learn and get yourself educated so that you're prepared when it comes. Because I think the reality that everyone needs to accept is that this is coming. It's here for a lot of us, and it's probably not going anywhere. And one day in the future, we will have a vaccine. And I just want everyone to remember that how important vaccines can be. I'm not saying all vaccines are perfect, but I definitely think that people need to realize that in Western medicine, while I don't agree with everything that we've done, I think we've really dropped the ball on metabolic disease and obesity and our understanding about hormones. What we've done a pretty darn good job at is controlling infectious disease. And what we're seeing now is the result of a society that is sort of unsustainable. And I think that we all have to remember what we're seeing is something that we've created and not be so fearful, but instead educate ourselves and prepare ourselves like we've been talking about. I think my message here is probably going to alarm some people. And I think some people need to be alarmed, and some other people will find reassurance and calm down. And I think that's okay. I don't think this is something to be taken lightly.
Yeah. Well, thank you so much for all this info and research you guys have done. I think we should reconvene. We'll have some more episodes shortly on stay on top of all this. But I like this message. Just stay calm, stay positive, connect with your loved ones, eat healthy, do whatever you can, and don't cause a scene and buy up everything. And I think we can hurt people. If you're hoarding all the food, then other people can't get it. So
absolutely.
Any other closing thoughts?
I just wanted to add, that as well. Think of the other people that might not have access. And as well, there are resources, people struggling with their mental health. At this time, there is a 24/7 free confidential hotline. You need to text SHARE, SHARE, to 741-741. So if anyone just feels like they're isolated, because we all are, and you need someone to speak to, there are hotlines out there, and there are groups that are currently forming to help people specifically with this, with any anxiety, depression, or anything else that might come up.
That's great.
That's great. And the world is watching. America, we need to show love for each other, love for our healthcare providers, love for our neighbors. And that's how we're going to get through this. It's not by panicking and going to the store 10 times and buying everything. It's by loving each other. So just do that and everything will be okay.
It's great words to go out on. Thank you so much, and we'll check back in soon.
Thank you.
Thanks, Brian.
Bam, there it is. You can find out about everything we're doing at sapien.org, and it'll link out to all the other projects like Nose to Tail, Food Lies, the technology we're building. You can join the newsletter there. And don't forget about the Food Lies YouTube, where we have videos coming out every week. Lots of good stuff going on. Follow me on Instagram at food.lies, and I'll see you next week. Stay happy and healthy, my friends.